Thank you very much. This is better now. Thank you very much for being invited here in the European Parliament. Thank you very much, Ms. Kattenbach and Ms. Sichel. It is a great pleasure for WHO to be invited for this meeting. And thank you very much for inviting WHO by the Better Oral Health platform group. It is the case that WHO, of course, is concerned by world health, but also European health. We have a European office that works effectively with the European Union, and we're happy for that collaboration. And it is the case that I was asked to give an appetite of the oral health situation in Europe, and particularly to give an appetite of what are the main strategies for improving oral health in this region. It is the case that I will give this appetite on the burden of oral disease. I will discuss the social context of oral health and oral disease, and then I would focus on some strategies for prevention and promotion of oral health in the 21st century that already started. It is the case that the outset of this discussion of oral disease now has been the increasing burden to countries and to people, and money-wise, this burden on chronic diseases or non-communicable diseases. It is the case that this is a major problem in Europe, but this is also a global problem, and that's why the United Nations in September last year emphasized the importance of oral disease, oral health, as a part of that burden of chronic diseases. It is the case that years ago, actually, the WHO Office for the European region emphasized the importance of chronic disease prevention. And in the Health 21 document, Policy for Europe, we find the chronic disease issue very much discussed, and oral disease is part of that. We have targets or goals for oral health that I will now discuss a little. Here you see some essential conditions in this slide. For those present that are non-dentists, I tell you that in a few seconds I will present a slide on what is the burden of dental caries in European countries. I will not discuss that much periodontal or gum disease because we lack information, reliable information on periodontal disease, and therefore I will more discuss tooth loss, which is an outcome of dental caries and periodontal disease. And then finally, oral cancer. It is the case that the WHO in the year 2000 formulated goals for oral health for the year 2020. And at that time, it was emphasized that at least 80% of children at the age of 6 should be free of caries, and we should have, you can hardly see some of it I see, we should have on average no more than 1.5 decades missing and filled teeth. That's the burden of dental caries, the amount of dental caries expressed in this way, and that goes for 12-year-olds. And how's the map now in relation to the 12-year-olds and in relation to achieving such a goal? You see on the left side, there are many countries of Europe having achieved that goal of 1.5 decade missing and filled teeth at the age of 12. There are some countries in that in our region that still have high burden of dental caries. That includes also some of the EU member states in the Eastern, Central and Eastern Europe, and also we see that for the Russian Federation. It is the case, oh my goodness, it is the case that there should be a red bar next to all the yellow bars. I don't know whether we can make it a little darker so you have a chance to see that. because that's the most important information. You can see it? Okay. I can tell you also what I see. I see a curve of high dental caries prevalence in Hungarian children in 1985. And this decreased dramatically towards the year 2008. And that parallels the situation in a country that I know very much about. It compares to the situation in Denmark that has one of the most comprehensive prevention programs for oral health. So it is the case that despite that the country of Hungary is not on the list of countries with a low dental caries, in the years to come that will happen. So there's a very good wind blowing for oral health in children. That is not the case for older people that have lost all their teeth. We made in WHO a survey in 2003, a cross-country survey using the same questions and methodologies for assessing tooth loss. And you see from the European part of that database, there's huge variation across Europe in the number of people not having natural teeth. This is what you see. From Ireland, in highest figure, half the people in Ireland do not have natural teeth, down to a little lower than 20% in Denmark. For all these countries, let me say that for all these countries, having looked to the oral disease prevalence in yellow card, okay, having that information from countries, we have social inequalities, both for those countries having the best situation and for those countries having the worst. This is informing about oral cancer. That is also showing up very huge differences in incidence rate of oral cancer. What is most important in this slide is that it emphasizes that all the risk factors on your left hand and the outcomes on the right hand are interlinked. But what is the implication of this? The implication is if you manipulate tobacco, alcohol, diet, and stress and hygiene, you will have an impact to several chronic diseases, not only oral diseases. And this is most important information. We also know from the information we do have for the European countries that the inequity problem is very high. Liver conditions pays a lot to whether people are served or not served. So universal care is important to WHO in this sense. My goodness. You see here, you see here a illustration of how many people in the various countries actually make use of dental services. And it will be the highest figure for Sweden and the lowest figure for Poland. But for all countries, you have social inequalities. This is much better because this is blue color. This is telling about, this is also more important. It shows the take-up of preventive services by the users of services, being highest in Scandinavia and lowest in Poland or in Eastern European countries of this region. We have made an effort in WHO to emphasize the importance of prevention and health promotion. And that is based on the fact that oral health is linked to chronic diseases. You may see certain chronic diseases here of importance also to quality of life. I have not seen the card from you. Okay, it is a case that prevention of oral disease or chronic disease have several outsets. We are in WHO. We're concerned about settings for health, healthy environments. We're concerned about the risk factors in public health, the risk factors are manipulating risk factors is most important. Developing health systems is important. Equitable health services is very much prioritized by WHO. And we focus on target groups, and particularly children and youth. And at the bottom here, you should read older people. So in this document on equity, social determinants, telling about what can we do in public health programs. There's a guide. There's no excuse for not doing anything in relation to social inequality. We do not need more surveys. What we need is action. So, dear politicians present in this room, do not hide. Try to get on the agenda of improving oral health, also by particularly looking to these social determinants.
Well, thank you very much indeed.